What's up, everybody? Welcome to Titan Medical TV. My name is Jerry Ward. I'm here to tell you guys a little bit today about how Titan has absolutely changed my life and got me back on track health-wise. Now, the first thing that I had become exposed to from Titan was their vitamin therapies, their amino acid therapies, their vitamin therapies, and they were injectable, which really caught my attention because I wasn't really aware of much on the market that was like that. But I did remember, and this, I go way back. I mean, I've been doing this stuff for a long time. The L-arginine and L-ornithine were two amino acids that were pretty popular in the 90s and were supposed to raise growth hormone levels, and it never panned out. When you look back at the studies, you actually find out that those amino acids in the study were used injections. They were not orally available. That's not what they were doing. So I remember I said, you know what? These amino acids in injection form, they're more bioavailable. They don't pass through your liver. It's completely different. They're ready, and you can take less of them. They're ready to be used for energy, rebuilding, everything. So I said, okay, let me give it a try. So I contacted Titan. I went through the process of being screened, the nurse practitioner, talked to the doctor and everything. And they prescribed my first ones, which were the Titan Hercules and Titan Complete. Those are the first two that I went on. And I noticed the pumps were better. I felt overall better, more energy. I just felt better in general after being on them for a couple of days. Fast forward, there's ephedrine, caffeine, and aspirin product, the ECA product, which also has vitamin B12 in it and chromium. Now, it's a great fat burner. It's a great pre-workout, but I have ADD. Ephedrine has always helped me with my ADD and control it. So I went on these specifically for the ADD, and I take them pre-workout, which also helps, but they last me pretty much all day long. So the ECA is also for ADD as well as, pre-workout, fat burning. Now fast forward a little bit to HRT and TRT. Okay, I was already with another doctor doing HRT, and I wanted to switch to Titan because I was super happy with them and super happy with their staff. I said, you know what, I just want to be dealing with them alone. So I had to make the appointment. I get the blood work done. They said, first we need your blood work. We'll see what's going on. Then we'll have you do the consult with the doctor. I get the blood work back, and lo and behold, my liver enzymes were 500. I was taking a product called vanadyl sulfate, which is a natural vitamin mineral extract, which was super toxic to the liver, and I didn't know at the time. Now, when my liver enzymes came back, they immediately said, look, we need to get this, exactly what Titan said to me. He said, we need to get your health back on track. We need to get you back on track and be healthy. Let's not even worry about anything else right now. Let's just make sure you're going to be okay. The doctor flat out told me, had I waited 6 months, I would have needed a liver transplant. So there's a possibility that I could have died from taking that stupid supplement that nobody would have even thought twice about. But Titan caught it. They reversed it. They started me on the glutathione, the injectable glutathione, 200 milligrams. And in 1 month's time, 30 days, my liver enzymes went from 500 to 65. It's almost unheard of. Even the doctor was like, it's incredible how fast your body regenerated itself with this glutathione. Now I'm healthy. I'm feeling good. Like my skin looks different. I need less sleep. I just feel overall, I feel like I'm 20 years old when I'm 42 years old. Now it's time to look into the TRT and the HRT. The doctor prescribed me, we'll start out here with the testosterone. So I get the testosterone shot every week, along with Arimidex and HCG. Now, why HCG with testosterone? Because a lot of bodybuilders and competitors out there know HCG as a PCT, a post-cycle therapy, something you take when you come off testosterone. When you're on testosterone, your body starts to shut down natural production of testosterone, but also luteinizing hormone at the same time. So if you're injecting testosterone, your test levels will go up, but your luteinizing hormone stays low. Now the problem is, some people go on testosterone, whether it's a gel or an injection or whatever, and they don't feel better. Their testosterone goes from like 200 to like 900, and they don't really feel better because of the luteinizing hormone. When luteinizing hormone is low, it's the same effect and side effects as you have from low T. So now all of a sudden you still have lethargy, you're not healing properly, can't sleep. Like all these problems you thought were low T really are low luteinizing hormone. So Titan utilizes the HCG while on the testosterone to make sure your luteinizing hormone is up along with your testosterone. You just feel amazing. So it's a balance. They're trying to keep your body in a balance and not just flood it with one thing. The Arimidex obviously stops the body from converting estrogen into, testosterone into estrogen. And when you're messing with HCG, that could happen even more efficiently. So that's why they use those three things together. Now, I'm cruising along. I'm feeling great. I'm on my HRT. I got my Injectable Vitamins, ACA. I find out about another product they have called Titan Ultra. Now, what is Titan Ultra? Titan Ultra has been dubbed the Limitless product, which Bradley Cooper was in a movie called Limitless where he took this pill and it made his brain work better, basically, in a nutshell. Titan Ultra does the same thing. It makes your cognitive abilities so much more sharper. You're able to retain information better. And me with ADD, not only do I have a hard time slowing down, but I have a hard time retaining information. I have to read things 5, 6, 7, 8 times, and even then sometimes I have a hard time. Well, that was something for me. I said, let me try the Ultra. Took the Ultra, next thing you know, my days are more productive. I have more, I don't want to say energy, but you're more focused on the task at hand, and you're much less likely to kind of veer off into another, subject or track or whatever you're doing, specifically because you're able to focus, and the ingredients in it are helping people with Alzheimer's. So it's just an amazing product overall. So now I'm on all these therapies. I'm feeling like I'm 20. I'm 42 years old. I don't even know what to say. I've told Titan again, and I'll do it publicly right now. Thank you. Thank you for taking care of me. Thank you for taking care of my health. Thank you for getting me back on track and making me realize that it's not a scary thing. Many of you right now watching this are scared because you don't want to go to a doctor because maybe you took testosterone, maybe you took steroids, whatever it is you did to yourself, that the doctor is going to chastise for you. They're going to give you shit for it. They're going to stand there and tell you, well, you did this to yourself. And some doctors actually won't even remedy what happened to you, despite the fact that you don't have any testosterone being made or anything else. They'll just say, oh, well, sorry. Titan is very sensitive to that fact that they know, look, it doesn't matter how you got here, you're here, and you need help, and they're here to help you. So you guys, check out Titan Medical. Contact them now. Email, phone, carrier, pigeon carrier, smoke signals, however you got to do it. Get on the program, guys. You will not regret it, I promise. I'm BioS3, and I approve this message. And this is the BioS3 Bicep for Titan Medical, and we are out.